clinical trials fit in?
So clinical trials can fit in anywhere along the treatment trajectory for prostate cancer. It's not something that's reserved for, kind of late stage disease. So for example, for people with localized disease, there are different types of treatment strategies that might be available to maybe enhance the activity of, the surgery or the radiation that's planned. And so we might consider a clinical trial even for localized prostate cancer. And then anywhere along the way, there are standard treatments that are available. And then there's some experimental approaches that might be available. And the experimental approaches might be to add an additional drug to the standard, or to actually what we call de-escalate treatment, give a little bit less of the medication and see if the outcomes are the same. And these are tests. And so the control arm, when there's a randomized trial, is generally considered a standard of care. And then the experimental arm is, some alteration or deviation from that standard. But many of our trials are also single arm trials where we're testing some experimental regimen that all patients who participate in the trial will take part in. And it's really important for the patient to, ask what are the clinical trials available, what are the alternatives as far as standard treatments, and are there other clinical trials other than the one that's being discussed that might be appropriate for them.
Mm-hmm. Are there emerging approaches that patients should know about?
Yeah, so a lot of the emerging approaches are related to the genetics of the prostate cancer, as I just mentioned. And then, these different forms of radiation drugs are, in addition to the ones that have already demonstrated survival advantage, there are other ones in the pipeline. And then one thing that patients are very curious about is immune therapy approaches to prostate cancer. Now, the standard kind of immune therapy drugs that are approved for lung cancer and melanoma and kidney cancers don't tend to work particularly well for prostate cancer, but there are many clinical trials trying to combine those kinds of drugs with other drugs, or have newer approaches to immune therapies that patients with advanced cancer can certainly ask about. Again, all of this is really experimental, and people need to understand that these sorts of approaches aren't going to help everyone. But participating in a clinical trial allows our patients to contribute to knowledge that can be useful for other patients down the line.